Hello and welcome. My name is Rebecca Preza, and I am the healthcare facilitator at the University of California, Santa Barbara. And in this video, I will be presenting the behavioral health comparison. This presentation is intended for communication purposes only. Please visit UCNet for plan documents and complete information. In this video, we will cover type of care, behavioral health by medical plan, cost, telehealth services, and the Academic and Staff Assistance Program, ASAP. What can therapy do for you and your family? Therapy helps create an unbiased environment, a safe space to talk openly about your feelings, helps you see things more clearly, may help you identify your blind spots, may help you identify and manage patterns, and teach you new skills and coping strategies. The UC behavioral health plans cover therapy, medication management, addiction therapy, mental health treatment, and telehealth services. In addition, you can access various providers, including marriage and family therapists, psychologists, psychiatrists, hospitals, and treatment facilities. Each individual's needs or concerns vary. The UC behavioral health plans offer support for depression, stress or anxiety, conflict, marriage and relationships, coping with grief and loss, addiction needs, eating disorders, and autism. Each of the behavioral health plans is bundled with a UC medical plan. The medical plan you elect in the year is going to determine your behavioral health clinicians and coverage. For the UC Blue and Gold HMO plan, your in-network behavioral health provider would be Managed Health Network. For Kaiser HMO, you have the option between Optum or Kaiser behavioral health providers. And for the UC Care PPO, Health Savings Plan PPO, and Core PPO plans, your in-network behavioral health providers would be Anthem. Understanding medical costs. So each of the HMO plans have predictable copays for services, whereas for our PPO plans have deductibles and coinsurance. A deductible is the amount you pay each year before the plan starts sharing the cost with you. After you've met your deductible, you pay a coinsurance, which is your share of the costs after the deductible has been met. Your costs are based on the network the provider is in and the service you receive. You pay discounted rates for in-network providers, and you pay more for out-of-network providers. Let's take a closer look at the deductibles for behavioral health. Under the UC Blue and Gold HMO and Kaiser HMO plans, there is no deductible with in-network providers. Out-of-network is not applicable. The HMO plans do not support out-of-network services. Under the UC Care PPO plan, there is no deductible when using UC Select and Anthem Preferred behavioral health providers. For the Health Savings Plan, there is a $1,400 individual deductible and a $2,800 family deductible that must be met before the plan is going to begin co-sharing in the cost of services. And finally, the core plan has a $3,000 per individual deductible that also must be met before the plan will begin co-sharing in the cost of services. Here's a breakdown of the behavioral health cost by plan. For the UC Blue and Gold HMO, Kaiser HMO, and the UC Care PPO, your in-network cost for the first 3 visits is $0. Each visit after that is $20 per visit. There is also a $250 per admittance of course treatment. For the health savings plan and core, again, your deductible must be met before the plan is going to start co-sharing in the cost of services. Once you've met your deductible under the health savings plan and core, Anthem will pay 80% and you pay 20% of the allowed amount. How do I get started with behavioral health? Under the UC Blue and Gold HMO plan, you can contact Managed Health Network, MHN, directly or visit their online directory for a choice of clinicians. For Kaiser, you can contact Optum or visit the Optum online directory for a choice of their clinicians. You do not need a referral from your primary care physician to access behavioral health services. For the UC Care Health Savings Plan and Core, you can contact Anthem Health Guides directly or visit the Anthem online directory for a larger choice of clinicians. Under these plans, you may select in-network and out-of-network clinicians. However, please note that cost will vary. Again, you do not need a referral from your primary care physician to access behavioral health services. Making the most of your medical and behavioral health coverage. Each of our plans also provide telehealth services. Telehealth services provide 24/7 access to board-certified medical and behavioral health providers. Here you will have an opportunity to consult with providers using your mobile device or computer. You do not need a referral from your doctor to speak with a behavioral health provider, and the costs will vary by plan. For the UC Blue and Gold HMO plan, the new telehealth provider as of January 1st, 2021 will be Babylon. Babylon replaces Teladoc as of January 1st. For Kaiser and the Optum, One Doc Way will continue to be the telehealth provider, and for the UC Care Health Savings Plan and Core, Live Health Online will continue to be the telehealth provider for our Anthem plans. As of January 1st, 2021, Babylon will replace Teladoc as the telehealth provider for the UC Blue and Gold HMO plan. Using your smart device, feel free to scan the QR codes to download the app now. After you've downloaded the app, you want to register using the HNCOM code, and then you can add yourself and your family members under 18 via the app. OneDocWay will continue as the telehealth provider for the Kaiser HMO plan. Feel free to take a moment to scan the QR code to connect with a telehealth provider via OneDocWay now. Live Health Online will continue as the telehealth provider for our Anthem plans, UC Care, Health Savings Plan, and Core. You must be 18 years or older and a U.S. resident to register. Additionally, minors between the ages of 10 through 17 can be seen through a guardian's account. Feel free to scan the QR code now to connect with the Live Health provider. Finally, I'd like to take a moment to introduce you to our Academic and Staff Assistance Program, ASAP. ASAP offers free and confidential counseling services to UCSB faculty and staff, which typically ranges between 3 to 5 short-term therapy sessions. The ASAP team also provides consultation and coaching for UCSB departments and supervisors, as well as wellness programs and threat assessment for the campus. You can connect with the UCSB ASAP staff by phone, email, or submitting the Contact Us form on the hr.ucsb.edu/ASAP webpage. To conclude this presentation, I'd like to share the many resources available to you during the open enrollment period. At the UC Virtual Benefits Fair, you can attend plan-hosted webinars, ask questions, and virtually connect with plan administrators. The UCNet Open Enrollment website is available for you to access and review all open enrollment plan documents and changes, including 2021 plan costs. Once you are ready to make your changes, you will need to log into your UC Path account and complete the open enrollment module. You can also submit benefit questions and general open enrollment questions via the UCSB HR ServiceNow. The UCSB Healthcare Facilitator Program is available to assist with complex healthcare needs or difficult medical, dental, or vision plan transitions. Let's continue to stay strong and stay healthy.